previous studies have shown that paramagnetic lesions, or PRLs, are associated with various forms of increased disease severity in multiple sclerosis, for instance, increased disability or increased brain atrophy. So we wanted to show or test whether PRLs were associated with increased relapse. Our motivation for this is we had previously published a paper showing that PRLs were associated with relapse over shorter time frames, 2 to 3 years. And so we wanted to test this over long time frames. One, to really try to better understand the role of PRLs in overall MS disease, and two, potentially for use, as a clinical decision-making tool. If this really is associated with increased relapse, this might help clinicians and patients decide on which disease-modifying therapies they want to use. So what we found is that when we detected these PRLs at baseline, they were in fact associated with greater relapse rates over 10 years. And in fact, the presence of one PRL or more versus none was associated with a greater risk of relapse of over 4 times in people with clinically isolated syndrome or relapsing-remitting MS. And so really what this tells us is that we believe these PRLs might be, in addition to being a marker of progressive disease, also a marker of just overall disease severity. Currently, and especially in the last decade or so, there have been some very good disease-modifying therapies that are really able to control relapses very well. That's kind of what they're targeted for. But a lot of these DMTs are associated with pretty severe side effects in some cases. And so the decision of what therapy to use is still very much a collaboration between the patient and the provider. And so, what I'm hoping is that this can be used as a tool for them, additional piece of information that maybe they can look at and say, does this favor one type of disease-modifying therapy or another?